You took a pill this morning. You probably did not think twice about it. 10 seconds, same as yesterday, same as every morning since your doctor handed you that prescription. And if you are over 60 and that pill is Amlodipine, Losartan, or Lisinopril, there is a very real chance that something is happening inside your body that nobody properly explained to you on the day you were handed that bottle. Here is a number worth sitting with. Nearly half of all Americans over 60 are taking at least one blood pressure medication right now. And most of you were given the same thing, a prescription, a handshake, and about 2 minutes of explanation for something that genuinely deserved much longer. His name was Clarence. 76 years old, retired postal supervisor from North Carolina. Disciplined. Proud of how carefully he had managed his health into his 70s. On amlodipine for blood pressure, had not missed a single dose in 14 months. His wife Nadine called me on a Tuesday afternoon. Her voice was flat with worry. Dr. Okafor, he has stopped going to his Sunday group. His ankles, I do not even recognize his ankles anymore. Clarence had not had a heart attack. He had simply been sitting with swollen ankles for 3 months, convinced his heart was failing, skipping doses on the days he needed to walk because he was embarrassed by what his legs looked like. That silence almost cost him everything. My name is Dr. David Okafor. I have spent over 20 years in internal medicine. And what I am about to share with you are the 9 most important things every senior on these 3 medications needs to understand. The 9th is the one almost no doctor says out loud, and it changes everything. Stay with me. Before we go further, drop your age in the comments right now and tell me this. Have you noticed any symptoms since starting your blood pressure medication that you quietly wrote off as just getting older? I want to know, because what you write might matter to someone reading it who thought they were completely alone. And if honest, clear guidance is what you have been looking for, subscribe now. I publish every week for people who want real answers about what is happening inside their body. Most seniors remember the same experience at the doctor's office. A few minutes, 2 words across a desk, high blood pressure, then a prescription. No real explanation of how these 3 drugs work differently inside your body, and honestly, that difference matters more than most people realize. Amlodipine, Losartan, and Lisinopril all lower blood pressure, but they do it through completely different systems. And those different systems create completely different side effects. If you do not understand that, you will misread what your body is telling you. So which one are you on? Keep that in mind as we go. Amlodipine, the calcium channel blocker. Your artery walls are surrounded by smooth muscle. That muscle tightens when calcium flows into the cells. Think of your artery wall as having small entry gates for calcium. Amlodipine reduces how many of those gates stay open. Less calcium getting in, less tightening, pressure falls. But, and this matters, it does not remove the reason those vessels got tight in the first place. It manages the output, not the cause. Lisinopril, the ACE inhibitor. Your body produces something called angiotensin II, a substance that tightens blood vessels and tells your kidneys to hold on to more fluid. To make it, your body needs an enzyme called ACE. Lisinopril blocks that enzyme. Think of it like shutting down the factory that manufactures the tightening signal. No factory, no signal, lower pressure. And because it also eases workload on the kidneys, Lisinopril is often chosen when someone is managing both blood pressure and early kidney concerns. 2 jobs, 1 pill. Makes sense, right? Losartan to IARB. Losartan works on the same system as Lisinopril, but at a different point. Lisinopril stops the tightening signal from being made. Losartan lets it be made, but locks the door it needs to enter. Signal sent, door locked. Message never gets through. So if they work on the same system, why would your doctor choose one over the other? Good question. We will get there now. Here is something that rarely comes up at appointments. If you are African American and you are on an ACE inhibitor like Lisinopril. The research is clear. ACE inhibitors tend to lower blood pressure less effectively as a first-line treatment in Black patients, and the risk of a serious reaction called angioedema, I will explain that in a moment, is roughly 4 to 5 times higher. That is not opinion. That is data. And if nobody has had that conversation with you, you deserve to have it now. Remember Clarence, the man whose wife called because she did not recognize his ankles? Here is what was actually happening inside his legs. This is the conversation Clarence should have had before he ever stopped going to his Sunday group. Amlodipine relaxes the small arteries in your legs more effectively than it relaxes the small veins. Blood flows down easily. It struggles to flow back up. Fluid shifts into the surrounding tissue. That is why your shoes fit in the morning and feel tight by 6 in the evening. That is why the swelling disappears overnight and comes right back the next day. You ever press your ankle and the dent just stays there? Yeah. That is this. It is not heart failure. It is not kidney damage. It is a predictable mechanical consequence of how this drug works in your lower limbs. What made Clarence's situation dangerous was not the swelling. It was the silence. He started skipping doses because he was embarrassed, and his blood pressure climbed quietly for 3 months. Nobody knew, so here is the rule. Report swelling. Do not hide it. Skipping doses is far more dangerous than any swelling you have been living with. But I want to give you something the standard advice leaves out. Do not just report it. Walk in armed. Here's what to say at your next appointment. Doctor, I have been noticing ankle swelling since starting amlodipine. Is this the medication? And would switching to an ARB like Losartan control my pressure without this side effect? That is not a rude question. That is an informed question, and your doctor will respect you for asking it. And in the meantime, elevating your legs for 20 minutes in the evening and wearing compression socks during the day can reduce that fluid buildup while you and your doctor sort out the medication question. Simple. Free tonight, all right? If ankle swelling is the most common complaint I hear about amlodipine, there is one symptom on Lisinopril that people suffer through for months without ever connecting it to their medication. And the delay is what makes it tricky. If you are on Lisinopril, have you developed a cough since starting it? Not wet, not productive, dry, scratchy, a tickle that nothing clears. Here is the part that catches people. It does not always start right away. Actually, I should be more specific here because the word delayed does not quite capture it. I mean weeks, sometimes months. That is the part that trips people up. By that point, you have completely stopped connecting it to the drug. You blame allergies, reflux, dry air. You buy lozenges, you change your detergent, and the answer is sitting in your pill organizer every single morning. Lorraine was 69. Church choir director, singing was her whole life. 4 months after starting Lisinopril, she developed a tickle in her throat that would not leave. Sleepless nights, exhaustion. She could not hold a note through a full verse anymore. She replaced everything in her home. When I asked when the cough began relative to her medication, she went completely still. Nobody had told her the Lisinopril cough can arrive late. She told me later I thought my singing days were done. Turns out the answer was in my pill organizer the whole time. A dry cough is uncomfortable. It is not dangerous. But there is one symptom that cannot wait, and this is the angioedema I mentioned earlier. Swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult. That is emergency care, immediately. ACE inhibitors can cause this in rare cases, and it can become life-threatening within minutes. Remember what I said about African-American patients? That risk is roughly 4 to 5 times higher. You hearing this for the first time right now? Dry cough, report it. Throat swelling, move now. And here is your question for the appointment. I have developed a persistent dry cough since starting Lisinopril. Could this be the medication, and would switching to Losartan resolve it while still managing my pressure? Okay, So cough and swelling are symptoms you can feel. But the next danger, you will not feel it at all. And it is probably sitting on your kitchen counter right now. Think about your kitchen, not your medication. Your kitchen, because one of the most serious risks for seniors on Losartan or Lisinopril is sitting on your counter right now. Both of these medications can raise potassium levels in your blood. When potassium climbs too high, it affects the electrical rhythm of your heart. The symptoms do not always announce themselves. Muscle weakness, occasional cramping, a skipped heartbeat, sometimes nothing at all until it is serious. Scary? A little. But manageable once you know where to look. Salt substitutes, the ones labeled heart healthy, replace sodium with potassium chloride. Electrolyte powders. Senior meal replacement drinks. How many of you have one of those sitting on your counter right now? Every one of these quietly adds potassium onto a body whose medication is already retaining it. Henry was 74, widower, cooking for himself for the first time in 40 years. He switched to a potassium salt substitute because he thought he was doing the right thing for his heart. He was on Losartan. Nobody connected those dots. He started feeling weak. His potassium came back dangerously high. Henry was not careless. The gap was not in his discipline, it was in his information. So 2 things. First, read every label on every heart-healthy product in your kitchen tonight. Second, next time you are in that office, 2 sentences. When was my potassium last checked? Is my salt substitute safe with this medication? Watch their face. They will be glad you asked. Now, there is something in your bathroom cabinet that combines with what we just talked about to create a problem your kidneys will not warn you about. That is thing 5. Check your bathroom cabinet the moment this video ends. Look for ibuprofen or naproxen. If you are taking Lisinopril or Losartan, especially with a water pill, regular use of these pain relievers can reduce blood flow to your kidneys. Not because any one of them is dangerous alone, because together, in a slightly dehydrated body, they create conditions the kidneys struggle to manage. You might be thinking, I have been taking ibuprofen for years. Nothing happened. That is exactly the concern. The buildup is gradual and silent. Your kidneys do not send you a warning letter. Nobody mentions this at appointments because ibuprofen does not feel like a real medicine. It came from a shelf, so it never gets brought up. But it should. If you need something for pain, acetaminophen, that is Tylenol, is generally the safer choice for people on these blood pressure medications. But even then, do not guess. Your pharmacist can answer this in 30 seconds. Is it safe for me to use ibuprofen regularly given all the medications I'm on? That conversation is free. It may prevent a problem nobody saw coming because nobody thought to ask. Quick pause. If this is connecting some dots for you, if something I have said just explained a symptom you have been living with, take 1 second and hit subscribe. It genuinely helps this reach more people who need to hear it. And if someone you love is taking one of these 3 medications, send them this video right now. Do not wait until later. Now, what happens when your body loses a quart of fluid in 12 hours and you still take the same pill at the same dose? That is thing 6, and I have seen it put people on the floor. If you are on Losartan or Lisinopril and you get sick, vomiting, diarrhea, heavy sweating, unable to keep fluids down, the medication that worked perfectly yesterday may behave very differently today. These medications assume a body with stable fluid balance. When illness strips that away, the same dose can drop your blood pressure too far and stress your kidneys. The medication did not become dangerous. The body it was working inside changed completely. You see the difference? Vernon was 78, stomach virus. Could not keep much down for 2 days. Still took his Losartan every morning because, and I hear this constantly, I have not missed a dose in 13 months. That discipline was real. But that night he stood up from the couch and nearly went down. His blood pressure had dropped too low. His body was depleted and the medication pushed it further. The fix is simple, but you need to know it before you are sick, not during. Write this down and put it on your refrigerator tonight. If I cannot keep fluids down for more than 12 hours, I call my doctor before I take my blood pressure pill. That note costs you nothing. It could keep you off the floor. Okay, so your medication, your kitchen, your bathroom, all handled. Now let's talk about the tool most of you use every single day and how it might actually be making things worse. What is the most dangerous blood pressure reading you have ever seen on your monitor? It is not the highest number. It is the one you took at the wrong moment and made a decision from. Blood pressure moves constantly with sleep, stress, caffeine, posture, and the anxiety of checking it immediately after worrying about checking it. Wild, right? The act of worrying about your number can raise the number. A single reading is not a verdict. It is a snapshot. Vivian was 67, retired nurse's aide, so she knew just enough to scare herself. She checked her blood pressure every time she felt anxious. Page after page of numbers, heart full of fear. She was certain her Lisinopril had stopped working. When we slowed everything down, same time, same arm, 5 minutes of sitting quietly first, a completely different picture came through. Her medication was working the whole time. The chaos was in the method, not the medicine. Sound familiar? Here's the rule, and I want you to memorize it. Same time every day, same arm, same chair, 5 minutes of rest first, then measure. React to patterns, not moments. One number is noise. A pattern is information. Only information deserves a decision. Oh, and one more thing. If you are writing your numbers down in a notebook, bring it to your next appointment. And here is the question worth writing on the first page. Doctor, my home readings over the past 2 weeks show this pattern. Given that, is my current dose still the right one? Your doctor will learn more from 2 weeks of your home readings than from one reading in the office with your coat still on. Your medication is doing its part. But here's a question I ask every patient who tells me their numbers are just not budging. What is your medication working inside? 2 patients, same age, same medication, same dose, completely different results. I have seen this across 20 years. The medication is identical. The body it is working inside is not. High sodium means more pressure building inside your vessels. Your medication works harder just to hold the same ground. Poor sleep raises cortisol, which tightens the very vessels your medication is trying to relax. Excess weight adds cardiovascular load that no single pill fully compensates for. You have heard all of that before, but here's the part that almost never gets discussed. What you can actually add specifically that research supports: beetroot juice. I know, not glamorous. But a meta-analysis of clinical trials found that about 250 milliliters daily, roughly 1 cup, reduced systolic blood pressure by about 4 to 5 points. The mechanism is real. Dietary nitrates convert to nitric oxide, which relaxes your blood vessels. Think of it like oiling a stiff hinge. The door opens easier. Can you get that at a regular grocery store? Yes. Juice aisle, hibiscus tea. Clinical trials show that 3 cups a day reduce systolic pressure by about 7 points over 6 weeks. 7 points, that is in the range where your doctor starts paying attention. Magnesium, but not just any magnesium. Magnesium oxide, the cheapest form you will find on the shelf. Your body barely absorbs it. Look for glycinate or citrate, 200 to 400 milligrams a day. Research shows a reduction of about 2 to 5 points systolic with stronger effects at higher doses taken for at least 3 months. Look, I take magnesium myself, have for years. So I'm not telling you anything I have not tried in my own kitchen. And if you are also on a statin, ask about CoQ10. Statins can deplete it, and supplementation has shown modest blood pressure benefits as well, roughly 3 to 4 points systolic. Worth a conversation now. I want to be clear about something, and I will only say this once in this entire video. These are complements. They work with your medication, not instead of it. Before you add anything, even something from a grocery store, mention it at your next appointment because interactions are real. When your medication and your body's internal environment are pulling in the same direction, results are stable. When they are fighting each other, doses climb. Not because the medication is failing, but because the system is working against itself. Everything so far has been about understanding what your medication does. Thing 9 is the part almost no doctor says out loud. And honestly, I waited too long to start saying it myself. In over 20 years of practice, after thousands of appointments and thousands of prescriptions, the single most important truth about these 3 medications is the one almost never said on the day the prescription is written. None of them erases the condition producing your high blood pressure. Amlodipine relaxes the squeeze on your artery walls, but the stiffness that built up over decades, still there. Lisinopril shuts down the factory, making the tightening signal. Great, except the vascular damage that cranked up production in the first place has not gone anywhere. And Losartan locks the door. The signal keeps knocking. All 3 manage the output. None of them erase the system producing it. This is why follow-up matters more than the first prescription. This is why the lifestyle changes we just talked about, they are not window dressing. They are load bearing. And here is the part nobody brings up, so I will. You might be thinking, can I ever reduce my medication? Can I ever come off it? That is not a foolish question. That is a legitimate medical conversation. And you are allowed to start it. Here is how, doctor. I have made a specific change. Lost weight, reduced my sodium, been exercising consistently, and my home readings have been below 130/80 for 3 months. Given these changes, would it be appropriate to discuss a dose reduction? Some patients do reduce. A smaller number come off medication entirely, usually after sustained lifestyle changes over months supervised and data-driven. That is real. It happens, but that decision belongs to you and your doctor together. Never to you alone at midnight reading something on the internet. Fair enough? The conversation is the first step, not the last. So let me pull all of this together for you. And then I want to tell you what happened to Clarence. If you take amlodipine, watch for ankle swelling, especially by evening. Dizziness when standing. Flushing. Ask whether switching is an option. Never skip doses to hide it. If you take Lisinopril, watch for a dry, persistent cough, even if it starts months later. And a red flag that cannot wait, any swelling of lips, tongue, or throat. Emergency care immediately. Oh, and if you switch from Lisinopril to Losartan because of that cough, the potassium warning still applies. Same system if you take Losartan. Read every heart-healthy label in your kitchen. Watch for muscle weakness, cramping, irregular heartbeat. For all 3, never use ibuprofen regularly without a conversation with your pharmacist. Call before your next dose if illness causes fluid loss. Measure blood pressure consistently, never reactively. And never stop or reduce on your own. Start the conversation first. Now, let me tell you what happened to Clarence. After Nadine's call, I adjusted his dose, reviewed what he was eating, and I sat with him, not his chart, with him, and explained everything I have just shared with you. He learned why his ankles were swelling. He learned it was not his heart. Within 3 weeks, the swelling was managed. His blood pressure was stable, and Clarence was back at his Sunday group. He told me at his follow-up, Dr. Okafor. I spent 3 months convinced I was dying from something that had a name and a simple answer. I just needed someone to explain it and teach me what to ask. 6 months later, he handed a 1-page summary to 23 men in his group. 5 went to their doctors with questions they had never known to ask. 2 had medication adjustments their doctors agreed made sense given how their health had changed. 1 had been living with dizziness on amlodipine for 7 months, writing it off as just getting older. The information existed. The fix existed. The conversation simply had not happened yet. After 20 years in internal medicine, the one thing I know with absolute certainty is this. The seniors who manage their blood pressure best are not the ones on the most medications. They are the ones who understand what is actually happening inside their body and who walk into their next appointment knowing exactly what to ask. Clarence did not need a different medication. He needed a conversation and the right questions to bring to it. So which of these 3 medications are you currently taking? Amlodipine, Losartan, or Lisinopril? Type the name in the comments. That single answer tells me what matters most to you and what I should break down next. And before your next blood pressure reading, carry this question with you. Do I understand what my medication is doing inside my body right now? And do I know what to ask at my next appointment? If the answer is not fully yes, that is not your fault. That is the gap this channel exists to close. I am Dr. David Okafor. Subscribe so you never miss the guidance your health deserves before the emergency you never saw coming.